Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. First of all, let me thank you all for coming here today. For everyone who don't know me, let me introduce myself first. My name is Salma Chairani Nur Azizah. I'm here on my function as Universitas Plus Merit Midwifery student. As you can see as well on the screen now, our topic today is about dengue fever. This topic is very important for us because of this disease rank have been commonly emerged in our life and surroundings. I divided my presentation into three main parts. First, I'll be looking at the definition and the cause. Second part is about the mechanism and the treatment. And the last one, I'll explain about the prevention. My presentation will take about 5 until 10 minutes. Don't worry for taking note, I'll pass my PowerPoint to you via WhatsApp group. If you have any question, feel free to interrupt me anytime. Did you ever know about dengue fever? I believe that almost of you have been heard about this outstanding disease. Wherever, from east to the west, north to the south, this tropical disease emerged generally in our country, Indonesia. And now, it's time for me to explain this disease to you. Can we get started? Okay, so this tropical disease called dengue fever. Dengue is highly endemic infectious disease of tropical countries and is rapidly becoming a global burden. Dengue varies from mild fever to severe condition of dengue hemorrhagic fever and shock syndrome. Globalization, which increased air travel and unplanned urbanization, have led to increase the rate of infection and help the dengue to expand its geographic and demographic distribution. It is caused by any of 4 serotypes of dengue virus, and it's transmitted within human through female Aedes mosquito from Stechomyia subgenus, including Aedes aegypti, Aedes albopictus, Aedes apollonesiensis, and the other member of Scutellaris group. Okay, now let's move on to the next point. Humans are infected with dengue viruses by the bite of an infective mosquito. Aedes aegypti, as the principal factor, is a small one with black and white body strip and prefers to lay its egg in artificial container commonly found in around home. Like this, and many more. There are 2 peaks of biting activity. Early in the morning for 2 to 3 hours after daybreak and in the afternoon for several hours before dark. After a person is bitten by an infected mosquitoes, the virus undergoes an incubation period of 3 to 14 days, average 4 to 7 days. During this acute febrile period, which may be as short as 2 days and as long as 10 days, the viruses may circulate in the peripheral blood. If other Aedes aegypti mosquitoes bite the ill person during this vermin stage, those mosquitoes may become infected and may transmit the virus to uninfected person. Of course, after an extensive incubation period of 8 to 12 days. How did us know that is a dengue fever or dengue hemorrhagic fever? Dengue is self-limiting fever, lasting for usually 5 to 7 days. These clinical features vary according to the age of the patient. The infants and young children might have undifferentiated febrile sickness with maculopapular rash. The older children and adults might have mild febrile syndrome or severe condition with high fever, usually pypsic, severe headache, retroorbital pain, myalgia, arthralgia, vomiting, nausea, and petesia. Leukopenia and thrombocytopenia are usually observed in all ages. In some cases, dengue fever may accompany bleeding complication. For uncomplicated cases of dengue fever, the treatment prescribed are bed rest, oral rehydration, and paracetamol as antipyretic and analgesic. Patients' health is monitored through various blood tests, from fever day 3 until the condition improves. Clinical signs that signal progression to severe condition or serious disease include 2. While dengue hemorrhagic fever is indicated by a rising of hematocrit more than 20% and falling platelet more than 100,000 per cube millimeters. If any of these signs are detected, immediate hospitalization is necessary. The treatment for dengue hemorrhagic patient is based on intravenous fluid therapy to maintain the effective circulation during plasma leakage, plus careful clinical monitoring of hematocrit, platelet count, pulse rate and blood pressure, temperature, urine output, fluid administered, and the other signs of shock. Patients usually recover within 12 until 48 hours of fluid therapy. Unfortunately, available tools to prevent dengue infection are very limited. There is no vaccine currently available, but effective prevention program may become a solution in this condition. Of course, they must have integrated components, including active laboratory-based surveillance, emergency response, education of the medical community to ensure effective case management, community-based integrated mosquito control, and effective use of vaccine when they become available. Don't forget 3M or 3M in Indonesian. Deplet, menguras, covered, menutup, and buried, mengubur. I think this fact is very important for us. Okay, that was the last page, and now let me just go back to the topic I told you earlier. Remember, dengue disease, including dengue fever and dengue hemorrhagic fever, commonly emerge in our surrounding. So, stay healthy, clean your cycle up, and knowing them as well as your enemy. I think it's enough. I think that's all from me. Thank you for your attention, and I'm feel free for having your question down below here. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Bye-bye.